They gave the new nurse the blind veteran because they wanted to watch her cry. Petra Holt had been at Garrison VA Medical Center for 11 days. 11 days of being handed the charts nobody wanted. 11 days of hearing the charge nurse call her the quiet one. 11 days of letting people assume the worst about her, because she had learned a long time ago that assumptions made better cover than any legend her handlers could manufacture. Jolene Pacheco set down her coffee mug and smiled the way people smile when they already know the punchline. Room 7, she said. Chief Warrant Officer Forces, retired, lost most of his vision in a mortar strike outside Kandahar, won't respond to verbal commands, won't tolerate physical contact from staff, broke a tablet last week and pulled out his own IV twice. She paused. We thought you might like a challenge. Behind her, Resident Ben Ashworth leaned against the medication cart with his phone angled just low enough to seem casual. Petra looked at the chart. Samuel Tran, bilateral visual impairment classified severe right, total left, admitted after collapse at a prosthetic consultation, dehydration, elevated heart rate, chest pain of unknown origin. A red flag ran across the top of the page. Non-compliant, combative, psych referral recommended. She had read that language before. It usually meant someone had run out of patients before they ran out of options. I'll take him, she said. Jolene looked almost disappointed. You sure? He threw a water pitcher last Tuesday. I'll take him, Petra said again. She walked down the hall without hurrying. Garrison VA smelled the way all VA hospitals smelled. Floor wax, recycled air, and the particular brand of waiting that accumulated in places where men came to be processed instead of heard. A veteran in a wheelchair near the window tracked her with his eyes the way people track movement when they've learned that stillness is survival. She understood that. She had been that still herself, in rooms where moving meant dying. She stopped outside room 7 and looked through the glass. Samuel Tran sat upright in bed with both hands flat on the mattress and his face turned slightly left, toward the corner of the room where the door hinge would be, not facing the window, not facing the television, facing the point where a threat would most likely enter. His jaw was set, his shoulders were rigid under the hospital gown in the specific way of a man who had learned to absorb pain without broadcasting it. The aide standing near the wall gave her a look that said good luck and I tried and please hurry all at once. Petra knocked twice on the doorframe, not loud, rhythm knock 2-1, a pattern. Samuel's hands changed on the mattress, fingers spread wider. She entered slowly, keeping her hands where they would have been visible if he could have seen them, because the body remembers posture even when eyes fail. The aide slipped out. Petra waited until the door clicked shut, then moved to the side of the bed and placed 2 fingers very lightly against the back of Samuel's left hand. Not grabbing. Touching the way you touch something you're not sure of yet. He went still in the way of someone suppressing a reflex. She spelled against his palm, MYYOURNURSE. The room held its breath. Samuel's head turned toward her by degrees. His right eye was clouded and still. His left moved in that particular way of severe visual impairment, searching for contrast, for shape, for anything the brain could use. His hand turned over beneath hers, deliberate, offering his palm. He spelled back WHOTAUGA. Petra spelled FRIEND. A pause, then WHASMARTKIND. Something shifted in the set of his mouth, not a smile, a door opening 1 inch. NOSTUDENTS. She spelled back a GREED. Then she wrote on the whiteboard in large block letters, close to his side of the bed where even diminished sight might catch contrast. Palm. Semps without single. No observers without consent. She turned back. May I take your vitals? He held up 1 finger, 1 question first. Go. What did they tell you about me? She didn't round the edges, that you're difficult. And you? She spelled carefully. I think you stopped cooperating because cooperation stopped working. The room settled around that sentence the way rooms settle around true things. He nodded once, slow and deliberate, like a man rationing trust. His blood pressure was 164/98, heart rate 118, oxygen 94 and drifting. He winced when she placed the pulse oximeter on his finger, and the wince traveled up into his left ribcage before he controlled it. She spelled, pain in your chest. His answer came slower, since this morning, different. Different how? He seemed to consider the question longer than the question required then, heavy, not the old kind. She listened to his lungs with her stethoscope after spelling the request and waiting for his single-finger permission. Left side clear, right side, wrong, not absent, not yet. But the sound had that particular dampened quality, like something pressing on something that shouldn't be pressed. She stepped back and wrote on her notepad, keeping it in his peripheral field. You need additional assessment, the attending said anxiety. His response was immediate. Attending is wrong. I know. Samuel's good eye found her again, slow and searching. His hand moved not to spell but to tap. 3 short, 2 long, 1 short. A sequence. She recognized it the way you recognize a song you haven't heard in years. Before your brain names it, your body already knows. It was a field communication pattern used by a very small number of people who had worked in a very specific kind of darkness. Petra's breathing stopped for half a second. He tapped it again, deliberate, testing. She should have looked confused. Confusion was the safe response. Confusion was the response of a nurse in bright blue scrubs who had never been anywhere more dangerous than a hospital parking garage after midnight. Instead, Samuel's oxygen dropped to 92 and she answered with 2 taps and a pause. Understood. I see you. Samuel went very still. His right hand found the inside of her wrist, just below where her watch sat, and pressed there once. He spelled 4 letters, W-R-E-N. The door opened. Jolene stood in the frame with Ben behind her, his phone no longer even pretending to be casual. How's it going? Jolene asked with the tone of someone who expected a specific answer. Room 7 needs Dr. Mercer, Petra said it walking, stepping into the hall, keeping her voice level. Now. Jolene's eyebrows went up. He just discharged from rounds. His rhythm is abnormal. Respiratory sounds are compromised on the right. Vitals trending wrong. Get him. Dr. Clifton Mercer arrived the way Clifton Mercer always arrived. With his stethoscope around his neck like an accessory, and irritation around his eyes like a frame. He was the kind of handsome that had never been told no by the right people at the right time, and it showed in the way he occupied space, always slightly more of it than he needed. He looked at Petra the way people look at furniture that is asked to be moved. Jolene said non-compliant, he said, glancing at the chart with the air of a man confirming what he already believed. Holt. She handed him the vitals log. He's not non-compliant, he's having a cardiopulmonary event and no one was listening. Mercer skimmed the numbers. Anxiety response. Classic in this population, tachycardia, chest discomfort. Diminished breath sounds on the right, that's not anxiety. He looked at her over the chart with the particular expression of a man deciding how much correction to tolerate. I've been practicing medicine for 19 years, nurse. Holt. And I think I can distinguish cardiac anxiety from. His O2 is 91 now. She showed him the tablet. It was 94 when I walked in, that's a 3-point drop in 8 minutes. Ben whispered something to Jolene. A sound like rookie diagnosing a decorated veteran. Petra heard it. She had been hearing that kind of sound most of her adult life. It stopped mattering around the time she stopped needing other people to confirm what she already knew. Mercer's chin lifted. Breathing treatment, document elevated anxiety. I'll revisit if it doesn't resolve. He needs imaging. He needs the treatment I ordered. Dr. Mercer. Her voice didn't rise. That man has a right ribcage that sounds like someone put a pillow over it. If that's not something you want to evaluate, I'll escalate. The hallway chilled. Mercer stepped closer. His voice dropped to the register people use when they want to make something feel private that they're actually saying in public. You are 11 days into your probationary period. You are not in a position to escalate anything. Petra met his eyes. If escalation oxygenated patients, doctor, you'd be right. Jolene made a sound. Ben's phone stopped moving. Mercer's face darkened in the specific way of men who are about to choose wrong. Give the treatment, document. If you escalate without my order, I will recommend your immediate review. Understood, she said. She returned to room 7. She gave the breathing treatment because she had been ordered to, and she watched Samuel's oxygen drop to 89 while she did it. She hit the rapid response button herself. The announcement split the unit. Rapid response, room 7, rapid response, room 7. What followed happened the way things happen in hospitals when time stops being theoretical. Fast, then faster, then too fast for anyone to pretend they were in control. Dr. Yvonne Park from pulmonology arrived first. She listened to Samuel's chest for 4 seconds, lifted the stethoscope, and looked at Mercer with the expression of someone who has found exactly what they expected and liked none of it. Right side is compromised, she said. Get portable X-ray. Mercer objected. Nobody listened. Samuel's oxygen hit 86 while the machine rolled in. He spelled against Petra's palm in short, urgent fragments. Heavy, worse, right side, can't. She spelled back, eyes on me, slow breath, I'm here. He spelled 4 letters again, Ren. She did not answer that one. The X-ray image loaded. Park leaned in. Her face changed in the particular way faces change when a diagnosis stops being a theory. Right pneumothorax, she said, with early effusion. Mercer stared at the screen. His hand did not move, his mouth did not move. Petra watched his face and understood. He knew what he was looking at. He simply was not yet willing to be the man who had missed it. Samuel's monitor climbed, heart rate 144, oxygen 83, his color had gone somewhere it had no business being on a living person. Petra opened the procedure kit. Mercer snapped, "Stop. That requires physician authorization and—" Samuel found her hand. He couldn't see what she was holding. He spelled with a speed the pain should have made impossible. "You do it, consent." "Patient consent given," Petra said. "Verbally confirmed via the communication system established at intake. You are not credentialed to perform independent needle decompression." "He is at 83%, Park said. "I am aware of." "Then act like it." Mercer went silent. Petra had already cleaned the site, second intercostal space, midclavicular line. She palpated the landmarks, adjusted 2 centimeters for the scarring she could feel beneath her fingers. Old blast trauma, dense and uneven. Her hands did not shake. She had done this once before, in a different kind of room, with different lighting, in a country most people in this hallway had never visited. She drove the catheter in. 1 second of nothing. Then the hiss, air under pressure escaping. Samuel's chest rose. The monitor climbed, 83 became 87, 87 became 91, 91 became 94. Nobody spoke. Park stared at the catheter. Jolene had gone pale. Ben's phone was at his side, forgotten. Mercer recovered first. Pride always moved faster than wisdom in men like him, but when he opened his mouth, a trauma surgeon walked through the door, and whatever he'd been about to say became irrelevant. Dr. Francesca Ewan took in the catheter, the X-ray on the screen, the monitor reading, and Mercer's expression in that order. She processed all of it in about 4 seconds. "Who decompressed?" "I did," Petra said. Ewan looked at Mercer. "Why didn't you?" The room did not breathe. Mercer said, "I was." He was at 83. Ewan was already moving toward the chest tube tray. "Good catch," she said it to Petra without flourish. 2 words. They landed harder than anything else that had happened in the last 20 minutes, because they were not performance, they were just true. Petra looked at the floor for 1 second. No smoke here, no rotor wash, no man bleeding into the dirt while someone waited for authorization that was never going to come in time. Just a hospital room, a breathing patient, and a truth she had known before anyone else in the building was willing to say it. She pushed the memory down. Samuel needed present time. The administrative conference room was far from alarms and blood, and the sound of monitors climbing back toward normal. It had framed mission statements on the wall and a table long enough to make everyone feel small at the wrong end of it. Harold Spate, the hospital administrator, sat at the head. Mercer sat to his right. Jolene sat near the door. Ben sat beside Mercer with his arms crossed in the posture of a man who had decided which side he was on about 3 minutes before this meeting started. Petra stood. She preferred it. "Nurse Holt," Spate said, "please sit." "I'm fine." Mercer's mouth twitched. Spate placed a folder on the table. "We're reviewing an unauthorized intervention involving Chief Warrant Officer Tran. A life-saving intervention. You do not determine that designation. His vitals did." Spate looked at her over his reading glasses. "You performed needle decompression without attending authorization." "I performed needle decompression with patient consent, in a language he uses and staff were refusing to learn." "You were instructed not to proceed." "I was instructed to watch him suffocate more slowly." Ben inhaled. Jolene looked at the table. Mercer leaned forward. "You are a probationary nurse with 11 days of service at this facility. You have no standing to make unilateral clinical decisions." Petra turned her head toward him, just slightly. "You have standing, and you chose not to use it." "This meeting is not about Dr. Mercer's decisions," Spate said. "It should be." Mercer's voice hardened. "You have a hidden communication method with a patient no one else could reach. You performed a procedure you have no independent credential for. You escalated without authorization. These are facts. The fact that matters is that he's breathing. There's another concern." Mercer opened a second folder. "Chief Tran called you something. During your second encounter with him. The staff nurse outside heard it through the door." Spate looked up. "What did he call you?" Petra's expression did not change. "I don't know what you're referring to." "Ren." The air in the room shifted. Jolene straightened slightly. Ben looked between Petra and Mercer. "What does that mean?" Spate asked. "Ask him," Petra said. "We're asking you." "And I've answered." Mercer smiled. It was not a kind smile. "That's not an answer, that's evasion, which suggests—" "Be careful with that word," Petra said quietly. Mercer spread his hands. "Or what? You'll save another patient without permission." The door opened. Dr. Yoon walked in, carrying Samuel Tran's updated chart and an expression that suggested she had been listening longer than anyone expected her to be standing outside. "I heard there was a review," she said. "This is internal," Spate said. "So is the patient's right lung, until it isn't." Yoon placed the chart on the table. Right pneumothorax, early hypothorax, delayed presentation consistent with blast-related scarring that altered standard anatomical landmarks. Standard decompression approach would have missed by 2 centimeters. Holt adjusted for it. She looked at Petra. "How did you know about the scarring?" "I palpated before I placed the catheter." "That's correct procedure," Mercer said. "Francesca." Yoon didn't blink. "Sit down, Clifton." He sat. That alone changed everything in the room, the way a single shift in weight changes a boat. Yoon looked at Spate. The intervention was clinically appropriate, performed with patient consent in his established communication method, and conducted correctly. "I'll defend it in any proceeding you'd like to schedule." She set a second page on the table. "I'd also suggest you look at who documented that this patient was non-compliant, and whether that documentation reflects an attempt to understand him or an attempt to stop trying." Spate read. His expression did not improve. The door opened again. This time, the room stopped. Samuel Tran stood in the doorway in a hospital gown with his IV pole gripped in his right hand and his left hand trailing the wall. A step-down aide hovered behind him, visibly distressed. "I tried," the aide said. "He wouldn't." Samuel spelled into the air with his free hand, slowly for anyone watching. "I walk myself." Petra moved before anyone else spoke. "You shouldn't be." He found her arm with the precision of a man who had learned to navigate by sound and pressure and memory. He spelled against her wrist. "Translate everything I say. Exact." She looked at him for a moment, then okay. Samuel faced the room. His clouded eye was still. His good eye moved across the space, reading contrast, reading shapes, reading what it could. His voice, when he used it, was rough and deliberate. The voice of a man who didn't trust rooms enough to speak in them often. "You assigned her to me because you thought we would both fail." Petra translated, though everyone had heard. "You wrote in my chart that I was combative. The word means you stopped trying before I did." His hand found hers. He spelled the next part for her alone. She hesitated one breath, then she translated. "She listened to me. You mocked her for doing it. That's not a hospital problem. That's a character problem. And it lives in this room right now." No one moved. Samuel spelled faster now. Petra's voice stayed even. "The man who ordered her not to treat me has my name on 3 prior complaints I filed through this facility system. I want to know where those complaints went." Spate looked at Mercer. Mercer looked at the wall. Jolene's hands closed together on the table. Samuel's heart rate spiked on the portable monitor the aide had wheeled in behind him. His color changed. Petra saw it. "Sit down now," she spelled it against his wrist. He ignored her. He spelled, "They gave you to me as a joke. I want them to understand what they actually gave me." Her voice was quiet. "Chest tube." He didn't move for 3 seconds. Then his knees buckled. She caught him. She was faster than anyone else in the room. She had him in the chair before Yoon reached the door, her hand on the IV line, her eyes on the monitor. "Breathe. Stay here." He spelled weakly against her palm, "Not leaving." "Not on my shift, you're not." The corner of his mouth moved, even now. They got him back to step down. Yoon followed. The aide pushed the chair. Spate stood in the conference room doorway and watched them go, and for the first time that afternoon, he looked like a man who understood that something had happened in his building that was larger than his meeting. The hallway talk started before Petra reached the nurse's station. She has some kind of private code with him. Mercer's filing a formal complaint. Did you see Jolene's face when he said the word? What does Ren mean? Petra walked through all of it without stopping. She had survived worse than whispers in quieter places, where whispering meant something different. But the whispers did something she had not planned for. They reached the veterans on the floor first. An older man in room 4, a Marine who had 3 tours and a knee replacement, and the particular stillness of someone who had learned to hold very still in very small spaces, lifted 2 fingers when she passed, not a salute, something older and quieter than that. A Vietnam-era veteran by the window looked at her face, the way people look at faces they half recognize from somewhere they don't talk about anymore. A younger amputee in the hallway stopped his wheelchair. "Chief Tran okay?" "He's stable," she said. The man nodded slowly. Somebody finally got through to him. She almost asked what he meant. Then she understood. The real wound in this building wasn't physical. It was the accumulated weight of men who had stopped expecting to be heard, who had learned to label their own frustration as the problem, because the system found that more manageable. She had come to Garrison VA to disappear among people who understood silence. She was beginning to think that had been the wrong reason. Jolene found her in the supply room at the end of the shift. She looked smaller than she had that morning. People usually do, when the day has done what this day had done. "Mercer is saying you manipulated the situation," Jolene said. "Of course he is. He's saying you encouraged Tran to escalate the complaint." Petra checked a shelf inventory without looking up. "And what do you think?" Jolene was quiet long enough that the quiet became its own answer. "I thought it would be harmless," she said finally. "Giving you that room. I thought he'd be difficult and you'd come out after 10 minutes frustrated, and we'd have a story. I didn't think about what it meant to him." "Humiliation is never harmless," Petra said. "It only looks small to the people doing it." Jolene flinched. It was a genuine flinch, which was the only kind worth anything. "I'm sorry," she said. "Are you sorry because you were cruel, or because the cruelty got witnessed?" Jolene didn't answer immediately, then quietly, "I don't know yet." It was the first honest thing she had said all day. "Figure it out," Petra said. "Start with whether you can say his name correctly. He's not room 7, he's Samuel." 3 days later, Spate convened a second review. By then, the complaints Samuel had filed, 2 years of them, routed through the facility's patient advocacy system and never formally acknowledged, had been requested by a patient rights attorney. By then, a records audit had shown that Mercer's documentation on 3 separate veterans included the phrase, "non-compliant due to cognitive limitations," applied to men who had been neither non-compliant nor cognitively limited, but who had communication needs Mercer hadn't wanted to address. Yoon attended without being asked. She brought 2 pages of clinical notes, and 1 page she did not show anyone, which contained the name of a senior Army medical investigator she had spoken to the previous afternoon. Ben Ashworth came to Petra before the meeting. He stood in the hallway with his phone in his pocket, which felt like a different kind of gesture than anything he'd managed in the past 2 weeks. "I recorded in his room," he said. "I know I did. I know what that means." "Yes," she said. "I wanted them to." He stopped. "I wanted to be the one they thought was funny. And now, I don't want that anymore." He said it like someone who had only just discovered what wanting the right things actually cost. "Good," she said. "That's where it starts." On the 5th day after the intervention, Samuel was well enough to sit in the chair by the window, morning light finding what remained of his useful vision. Petra sat beside him, not charting, not checking lines, just present. He spelled, "You came back." She spelled, "You were my patient." Before the assignment. She didn't answer right away. "You knew the taps," he spelled. "At Black River Station, 2009. 2 medics and a linguist got out of a compound that should have killed all 3. One of them was called..." "Stop." His hand stilled. She spelled carefully, "That person doesn't work here. She's wearing your watch." Petra looked at her wrist, the watch that sat over the scar she had stopped explaining years ago. "That name is retired," she spelled. "I'm a nurse." Samuel was quiet for a moment, then why? She thought about how to answer that. She thought about the room where she had made the decision, and the person who had sat across the table from her and said the words medically separated under sealed order, with the particular flatness of someone reading a form they hadn't written, and the way the door had felt behind her afterward. Not like an ending, but like a held breath. She spelled, "Because this is what I can still do that matters." He processed that, "Then you adjusted for my scarring." "I palpated first." "You knew what you were feeling." "Yes." "Because?" She didn't answer that one either. Samuel's hand found hers, not to spell, just to rest there. The morning light moved across the window frame. Somewhere down the hall, a monitor beeped twice and steadied. "I woke up without sight," he spelled finally. "I did not wake up without memory. I remember the hands that have helped me. I remember the ones that didn't try." Petra's eyes burned. She kept her face still because that had been trained into her in places where stillness was the only thing you could give someone when everything else was gone. "I should have reached you sooner," she spelled. "In this building, 2 weeks ago when they gave me your chart." He shook his head, slow, deliberate. "You came the day you came," he spelled. "You came when you could. That's not a failure, that's time." The policy changes Spate announced were not entirely voluntary. The patient rights attorney had something to do with that. So did the Army medical investigator, who arrived on the 6th day and asked very specific questions about documentation practices and the administrative routing of patient complaints. So did Dr. Yoon, who had a memory like a surgical instrument and used it with equal precision. But some of what changed because people chose it. Jolene signed up for the VA's ASL basic competency course before anyone asked her to. She told Petra about it in the medication room, with the particular awkwardness of someone practicing a behavior they aren't sure they've earned yet. "It's harder than I thought," she said. "Most things worth knowing are," Petra said. Ben Ashworth submitted a voluntary remediation request. His note to Petra was 6 sentences. The one that mattered was the last. "I used a patience limitation as entertainment. I will carry that. I hope carrying it makes me careful." Mercer resigned before the formal review concluded. The letter cited personal reasons. Nobody who had been in that conference room believed the personal reasons. Spate implemented 4 new policies. He read them aloud at a staff meeting with the stiffness of a man who understood that reading them was the least he owed. Every patient with communication needs receives a qualified communication assessment within 4 hours of admission. No patient may be labeled non-compliant without a documented attempt to establish their preferred communication method. No student or non-essential staff enters a patient room for observational purposes without that patient's explicit consent. No staff member may document or record a patient without authorization. Petra stood at the back of the room and listened. The words were right. Words were a beginning. Samuel attended his discharge appointment on a Tuesday morning. He walked in with the cane and the particular economy of movement of someone who had spent years recalibrating after loss and had arrived, not at acceptance, but at something more honest, the daily decision to keep navigating. He stopped at the nurse's station, the same station where the joke had started 17 days earlier. His hand found Petra's wrist. He spelled slowly for her to translate, and she did, because the hallway needed to hear it. "You decided I was impossible before I opened my mouth. You decided she was weak before she opened the door. You were wrong about both of us. My silence was not confusion. Her gentleness was not ignorance. You do not get to decide what people are worth based on what they cost you." He spelled one more line. Petra translated it without pausing. "The next veteran who comes through that door is watching how you treat me when I leave. Remember that." No one spoke. Petra walked with him to the elevator. His hand rested where she could feel it. At the doors he turned. He spelled, "Will you still be here?" She spelled, "Yes." "Good." The doors opened, he stepped in. She watched the elevator close. She stood in the hallway for a moment with her hand at her side, where his had been, in the particular stillness of someone who has done a thing that mattered, and has not yet decided whether to let herself feel it. Then she turned, clipped her badge straight, and walked back toward the ward. The badge said Petra Holt, RN. No rank, no designation, no call sign. She had been RN in rooms she didn't talk about, for people she couldn't name, doing work that would never appear on any public record. This was different work. Quieter, in some ways. Harder in others. The kind where you stood in a hallway for 11 days being underestimated, and then you stepped through a door, and you listened to a man no one else had bothered to listen to, and you used every broken and rebuilt piece of yourself to keep him breathing. And when it was over, you didn't ask for recognition. You asked for policy. Because recognition faded, but policy was a door that stayed open after you left the building. That was enough. It had always been enough. Some people came to work carrying their whole history with them, invisible, unremarkable in the hallway, easy to overlook. Some of those people were the only reason certain other people went home. The ward was busy. It was always busy. Someone needed something. Someone's monitor was chirping. Someone down the hall was having a harder morning than yesterday. Petra Holt walked toward all of it. That was the whole story, and it was also where the story started.